Okay, so we did our project on preventing ventilator-associated pneumonia. So the CDC defines ventilator-associated pneumonia as a lung infection that develops in a person who is on a ventilator. This is important because it has up to 27% prevalence in those that are ventilated in the ICU, and the mortality rate for this is between 30 and 70%. So the CDC also mentions that VAPS, or ventilated-associated pneumonia, accounts for 60% of all deaths due to healthcare-associated infections. So it's definitely a big deal and definitely something we need to be working towards fixing. So this is where we formed our PCOT question. So we asked, in ventilated adult patients, are usual oral care measures utilizing non-chlorhexidine or chlorhexidine more effective in reducing the incidence of ventilated-associated pneumonia? So we took a look at Orange Coast Memorial's current practice, and it only specifies that oral care should be performed every 2 hours. This policy lacks a clear definition of what oral care is, and the hospital itself provides a variety of solutions for oral care to be provided with. In healthcare, we all know we never want to have variety. We want to have a clear-cut, evidence-based best practice. So this is definitely concerning. And it also leaves nurses vulnerable. If you say choose an oral care that leads to a VAP, it leaves you vulnerable for legal action.
All right, so collectively we gathered 10 articles. Our focus was to get articles within the last 5 years and at the highest level of evidence. So we have 5 level 1 articles, which consist of meta-analysis and systematic reviews. And we also have 5 random control trials. The articles collectively support the hypothesis that chlorhexidine is successful in reducing the incidence of ventilator-associated pneumonia compared to other forms of oral care measures. The article that most supported the use of chlorhexidine was one of our meta-analysis published in the Cochrane Library. This study had 40 random control trials, and it encompassed every patient in the critical care unit that was mechanically ventilated in the last 48 hours. In comparing the use of chlorhexidine and other usual care, this resulted in moderate certainty evidence reducing the incidence of ventilator-associated pneumonia from 26% to 18%. Some threats and limitations, studies that did not include any blinding were seen to have a high bias. These studies addressed the potential bias and concluded that the risk was low and not sufficient enough to alter the results of the study, given the setting. Further threats were the omission of concurrent treatment regimens, such as antibiotics and other bundled care interventions.
Okay, so according to multiple institutions, such as the Infectious Disease Society of America, the NHS Critical Care Network, the Institution for Healthcare Improvement, and the Society for Healthcare Epidemiology of America, they all recommend that the use of chlorhexidine in ventilated patients should be used. However, they disagree on the concentration of chlorhexidine and what is effective. So we have 4 recommendations for decreasing the incidence of VAP. Our first one is universal VAP prevention bundle that can be incorporated in all hospitals. We also think that adding chlorhexidine at 2% concentration is most effective, and providing oral care with chlorhexidine should be performed at least 4 times a day to be effective. And we also think that staff in services with nursing and respiratory staff should be incorporated. So VAP increases the duration of hospitalization by 7 days, and this in turn increases healthcare costs by $40,000 per patient. So incorporating the use of chlorhexidine oral care will hopefully reduce the incidence of VAP, um, and it will result in a decreased duration of hospital stay, improving the cost of healthcare.
So, in summary, ventilator-associated pneumonia is the second most common and escalating cause of death among patients with hospital-acquired infections. But that is completely preventable with the rights of nursing and other members of the healthcare team. There's lots of ways you can prevent ventilator-associated pneumonia, but our article studies focus on the oral care and antiseptic solutions to prevent that. We found that chlorhexidine 2% was the most effective solution when done 4 times daily in conjunction with routine oral care. We recommend a clear standardized VAP bundle and more research to be done so chlorhexidine can become more widespread in the hospital.